Hi, it's Amy, licensed esthetician. This video is not going to be about skincare. I had made a video on TikTok, but I want to kind of expand upon it for those women out there that they should never experience what I experienced when this was from a female gynecologist. So let's see. So 2 years ago, I had my surgery. 3 years before that, my husband has a very rare form of bladder cancer. He's okay now. But I had a rocky 3 years of him having major complications from surgery, spending lots of time in an ICU with him, and I put on weight. I was just stress eating. My life wasn't normal. And his doctors were wonderful. And every doctor of his would come up to me and say, "What do you need? You don't have to be here every day. Like, Mark will be okay. Like, what can we do for you?" And I said, "No, I have a dog walker and everything," but they knew that one of his doctors said, "You do know the role of a caretaker is a lot." And I said, "Listen, I took care of my dad for 3 years. I understand that. I know when I need to take a break. But this is just life. And thank you for asking." And they all would call and check on me, the caretaker. And I've been really fortunate in most of my life. I only had one bad experience once with a doctor. But in general, I go to the doctor every year for my checkups. Anyway, my husband's home. He's recovering. His cancer is now under control. It's the type of cancer that he has to be in continual treatment. We're all good. And in that time, I say to my husband, I really let myself go. This has been really stressful. And now it's time for me to take care of me a little bit. Like, I got to go to a cardiologist. I got to get my blood pressure checked. Like, I just decided to, I get my teeth fixed. Like, now it's a little time for me to get back on track. And in that time, I do lose some weight from what I was stress eating in the hospital. Anyway, I joined a gym because I have a broken nose and I'm going to be scheduled for a surgery just to put a stent in and fix my nose. But I decide, you know what? I want to get into shape because even though I've only had a tonsillectomy, I need to lose some weight and I need my cardio and I want to go into this procedure healthy. So I spend $4,000 a year for this trainer and I'm not losing weight. And I'm getting fit, but something isn't right. And one day we're pushing the sled and I was increasing my cardio and then all of a sudden I take 2 steps of pushing the sled and I can't catch my breath. I cannot catch my breath. And my trainer says to me, "Are you okay? You're really pale." And I'm like, "I don't know. You didn't put any more weight on this." But I noticed that the past few weeks I wasn't feeling well and my weight was going up. And they kept saying, "Well, it's probably just you putting on muscle." And I'm like, "But I'm not losing inches." Anyway, in 6 months' time, my weight just pops up and I'm not feeling well. And I'm getting acid reflux and something's not right. And I go to my internist and she tests me for all of these things, but she doesn't touch me and says, everything appears to be fine, and sends me back off to the cardiologist who does an echocardiogram and says, "I can't find anything at all." And I'm like, "Listen, I feel like there's a heaviness in my chest." And he's like, "Maybe it's psychological. Maybe it's just stress. I don't know." And then I just blowed up to the point that my scrubs, because I wear scrubs every day as an esthetician, I can't put my scrubs on. And all my weight is around my center. Now, at this point, I knew I was due to go to a gynecologist. Now, my gynecologist, I don't need because I'm older, I don't need a baby gynecologist, but my gynecologist retired. So I'm calling around and everybody gives me this name of this women gynecological group here. So it's on the list to call, right? She comes highly recommended. Okay. In the interim, somebody says, "Oh, you need probably hormone replacement." And everybody's just saying, "It's just menopause, Amy. It's just menopause. You're just going to have to deal with it." And I go back to my primary care physician, who's a little overweight. And she's like, "Look, same thing happens to me. It's just menopause." I'm like, "This just feels different. It's all hard." No. And she goes, "Well, you go to the gym, so maybe there's a 6-pack under there." And I'm like, I don't think so. I don't know. I don't feel well. I'm not well. And I'm just chalking it off as menopause. But I'm thinking the women in my family didn't have these issues. Like, I am really struggling. So I'm thinking, well, they probably think that I'm lying to them, that I don't go to the gym, and that I'm probably like overeating. And I go to put on a pair of shoes, and I have to bend out and do the clasp. And I'm crying in the bathroom. And my husband says, "What's the matter?" And I'm like, I've had weight go up and down, but I can't even bend. It's like something's in the way. I can't reach my shoes. I said, I know I'm not a flexible person, but I literally, if I go to bend, I can't catch my breath. So a few days after that, I'm in my office and I wear scrubs every day, like I was starting to tell you, and I have to cut the side of my scrubs up. And I say to my husband that morning, if I didn't know any better, I feel like I'm getting my period. I'm bloated like that. My back hurts. Like, I don't feel so good. Now, at that point, I didn't have my period for like 8 months, so I'm like not really in menopause. I'm not having hot flashes. I'm not having anything. I go to my office, and I'm sitting like this, and I'm waiting for my client to come in, and I'm really not well. Now, this client that comes in, she's a retired medical assistant and worked for her husband, who's an OBGYN. She comes in, and she says, "Amy, are you okay?" And I go, "No, I'm really not." And I never really share information with my clients, but I really wasn't well. And she's like, "You don't look well." And I explained to her, and I say, look, I can't even put my scrubs on. And she says, "Stand up." And I knew she was a medical assistant, and she touches me, and she says, "You need an ultrasound, and you need it now." And she calls her husband. Now, they come from the other side of the county. And he says, and he recommends to me this woman's OBGYN group that I'm trying to get an appointment with. So he makes a phone call on my behalf, and they say, "Well, our tech is here. We can squeeze you in. Can you come today?" So I go, "Sure." And I go, and right when I get there, sure enough, I get my period. And it's a male tech. And I'm supposed to go for an external and an internal ultrasound. And I explained to him, and they're like, "No worries, we're used to dealing with this." And as he's scanning me, he says, and I'm looking at the scan because it's right there, and I'm like, "What's that?" And he says, "It's probably a fibroid." He's not saying tumor. He says, "It's probably a fibroid. Do you have history of fibroids?" I'm like, "Not to my knowledge." And then he measures it, and he goes, "Well, it's 24 centimeters." And I'm like, "No, you mean millimeters. 24 centimeters is almost 10 inches. And he goes, "No, you have like a basketball in there." He says, "Let me print out the report, and I'm going to take you in to see the doctor." I go into the doctor's office, and I'm waiting. And she comes in, and she's flipping, and she says, "Oh, my God. Oh, my God. Oh, my God." And I'm like, and I'm thinking, what is maybe she has her earpiece in and talking to somebody, and she looks at me and she says, "How did you let this happen? How did I let this happen?" And I have like no words. And I'm like, "Excuse me?" Not, "Hello, I'm Dr. So-and-so. Thank you for coming in. The other doctor referred you. We got your report." It is accusatory. "How did you let yourself get like this? Do you not go to a doctor? And I explained to her that I have been going to the doctor, and I've been having all of these other symptoms, and doctors just order tests because most doctors don't touch you anymore. And I said, "But, now I'm here because this other doctor, whatever." And she's just saying, "You probably have endometrial cancer, and it's probably so advanced. I don't even know if I can help you." And I'm like, "Huh?" And I go to talk, and I said to her, "I've been a caretaker for a cancer patient, and like I can't process the fact that my husband and I can both have cancer." And she goes, "Well, it's probably cancer. It's one of those, but it's probably really, really advanced." But she's like yelling at me. She says, "So I'm going to schedule you, and you're going to come back for a biopsy, but your insurance is not going to cover anesthesia, and it's really painful, so you're going to have to pay for anesthesia, otherwise you're going to have to suck it up." Just like that. And all I'm thinking is, I hear cancer, and all I hear is to her. And 4 times she says to me, how did you let this happen? Like, and I'm like, okay, now you're accusing me and you're judging me. I didn't force a fibroid to grow in my body. Like, I'm here now. So we go outside and I'm like in shock. And she's checking through her schedule to get me in like as an emergency. And I said, do me a favor, don't bother scheduling me. Can you get, and she, in the interim, she was telling me she was going to send me to the surgeon. I said, if you would so kindly just give me the surgeon's name, because I'm not coming back, because I don't like the way you spoke to me. And she says, fine. And she walks away, and the staff gives me the number. And I call, and I explain to them, and they schedule me right away, and they schedule a CAT scan for me, and I come into the doctor's office, and I am not telling my husband that I could possibly have cancer, because my husband, like, he can't handle that. Like, he has cancer. And I go to the doctor, and I'm almost, as he's telling me and explaining to me very calmly, very nicely, everything he sees, what he suspects it is, I'm crying. And he says to me, don't worry, Amy, we'll get through this together. I don't think this is a death sentence. I don't think it's possibly cancer. Why are you crying? Like, don't cry. And I said, I'm crying only because you're being so kind to me. And the other doctor was so horrible to me that I feel relieved that I didn't do anything wrong. And then he says to me, yes, I heard that about this doctor. So anyway, we make arrangements for my surgery. And I say to this doctor, there's one request that I'm going to ask of you. My husband is a cancer patient. And I'm going to tell him that the worst case scenario that could possibly be cancer. But my husband, I know, the thought of him and I both having cancer, he's not a good caretaker and it will overwhelm him. So this is what I want to do. And he explains to me that in the surgery, they do biopsies as they go, and then it goes out for pathology. If you are 100% sure that this is just a fibroid and nothing else, and there is no cancer, that when I'm in recovery, please tell my husband that it's not cancer. If you suspect that there is cancer, when you go out, just tell my husband we have to wait for pathology. Please don't say I will tell him. I don't want you to tell him unless we are 100% sure. Luckily, I have my surgery and everything's okay, and I'm in recovery, and they put me in a room, and my husband's there, and the first thing my husband says to me is, you don't have cancer. I knew that went out. I was like, that was my biggest concern, was like how my husband's emotional state would be. Anyway, my follow-up visits with my doctor were very good. The actual other doctor's office called me and said, you never came in for your follow-up. And I said, there was no follow-up. I basically fired Dr. B on the spot, right? And she says, well, we have you as a follow-up. I said, no, please take me out of your system. I'm not a follow-up. But after I recovered from everything, it really bothered me of how this doctor treated me. And yes, I was not going to sit there and take it. There are other doctors, and I stood up for myself. But I wrote her a letter, and I wasn't expecting a reply, and I did not get one. And I didn't go online to write a bad review, and I took the time to write to her and explain to her of how her tone was unprofessional, her accusation. She basically yelled at me, and that I hope she doesn't do that to other patients. No matter how good she is in her profession, her bedside manner was horrible. It really was. And that she put me on the defensive as like I caused this to happen to myself. That was a terrible thing to ever happen to me. And so I've learned now, not all doctors have the best bedside manner, and some of them, they're not they're human, but I've never, ever was put in that position except for one other time when I was younger, and it was also a male OBGYN for my annual checkup because my doctor was out on labor call and treated me horribly. And but I was too young to say something. And now that I'm in my 50s, I wasn't there to yell with her. And I didn't have to give myself an explanation. And I just said to her, Dr. B, thank you for finding what you did, but I'm not coming back to you because your tone to me. And I just said it in front of her staff to say, how you're talking to me and you're judging me is just not acceptable. And this is really uncomfortable. And you're making me defend myself when I'm here for your medical expertise. So ladies, stand up for yourself. If you're not comfortable with how your doctor is talking to you or making you feel, you can get up and leave. Okay? I know it's hard to find doctors with medical, with insurance and all these kind of things, but you know what? You owe it to yourself. And next time when I went to see my regular physician, I actually told her that I wasn't coming back. And she asked me why. And I said to her, you know, because I think also underneath of it, you were just either thinking I was lying to you, that I wasn't going to the gym or whatever, and you were just ordering tests. And if you just had me lay down and you pressed on here, just like the MA did, you would have felt a large mass that shouldn't be there. I mean, I had a 15-pound fibroid. That's like carrying 2 babies. So anyway, I hope you learned from this. I'm healthy now. I'm all okay. And that's it. So just so you know, you as a patient have a right to be treated in a proper professional manner. And that's it. So thank you for letting me share my story. And don't forget to go for your yearly checkups. And you know what? In the United States, a sonogram should be standard practice for women of all ages, because if I had an ultrasound sonogram, whatever you call it, an ultrasound, at my last gynecological visit as a standard procedure, they probably would have caught the fibroid and I wouldn't have had this big giant operation. So that's it. Other than that, everybody be well, and thanks for watching, and thank you for listening.